Chronic sinusitis is a condition in which patients are having a chronic inflammatory and infectious condition in the nose. Symptoms of that type of a condition typically include nasal congestion, facial pain and pressure, and yucky discharge from the nose. The balloon sinuplasty procedure is a method in which we open up blocked sinuses in patients that are suffering from chronic sinusitis. It's a minimally invasive approach, and it ends up being a pretty effective way to treat these types of patients. During the balloon sinuplasty procedure, what we're doing is we're going through your nose with some endoscopic instruments. There are no external incisions that are involved, and we're locating all of the sinus openings. Once we locate the sinus opening that is impacted, we place a tiny little balloon in that blocked sinus, inflate that balloon, which then allows proper sinus flow. Typically a balloon sinuplasty procedure is done under some IV sedation, and the duration of the case is anywhere from 15 to 30 minutes. So a common question I get is, how painful is this procedure? I generally like to grade surgical procedures on a scale of 1 to 10, 1 being the lowest amount of pain, 10 being the highest amount of pain. Generally, most individuals will report that balloon sinuplasty falls right in the middle, somewhere between a 4 and a 6. However, it's not infrequent that a patient will report no pain or discomfort whatsoever after this particular procedure. People that are considered good candidates for balloon sinuplasty are those patients that have had symptoms that have lasted for 3 months or greater, and are also patients that have no reports of polyps in their sinuses. Generally, polyps end up being a contraindication to balloon sinuplasty, meaning the patient that has nasal polyps is a patient that should not undergo balloon sinuplasty. Typically, if you have polyps, you have to undergo a more invasive procedure. Oftentimes people will ask, is it worth going through a balloon sinuplasty procedure? What are the benefits? Generally speaking, once you make it into my office, that usually is the telltale sign that your nasal and sinus issues are significant. You've now made it into a specialist's office, meaning that your symptoms are impacting your quality of life. Balloon sinuplasty is definitely worth pursuing if you're a patient that suffers from chronic sinusitis. Meaning if you're someone that experiences nasal congestion, facial pain and pressure, and a lot of yucky infectious discharge from the nose. It does end up being quite beneficial in those types of folks. Healing from a balloon sinuplasty is usually pretty straightforward. Everyone's healing time can vary. So one of the most common questions I get are, how quickly can I get back to regular activity? Generally speaking, patients can get back to regular activity within about 48 to 72 hours after they have the procedure conducted, meaning that they can have unrestricted physical activity. As far as how long it takes for you to totally heal and feel the benefits of the procedure, that time frame can vary. I usually tell folks between 2 and 6 weeks. Common question that we get asked as ENT surgeons is, what are the risks of balloon sinuplasty? Given that it's a fairly minimally invasive procedure, the risks are all across the board pretty minimal. One of the most common things that we encounter are patients that don't completely respond to balloon sinuplasty intervention, meaning that they continue to have sinus infections despite undergoing this procedure. In those types of patients, unfortunately, what we end up having to go through with is a more invasive surgery called functional endoscopic sinus surgery. There's some other more rare risks and complications that can arise from balloon sinuplasty due to the fact that we are working in a fairly high-priced real estate region of the body. We're working close to the eyes, working close to the brain, but I've never seen any complications in those particular areas come about with this procedure. So one of the most common questions that I get asked about what are some of the indications of balloon sinuplasty is balloon sinuplasty an appropriate treatment for snoring? And to answer that question, no. Balloon sinuplasty is not a treatment for snoring. Balloon sinuplasty is only indicated for patients that have sinus infections. What sets Capital ENT and Sinus Center apart from other ENT practices here in Austin is that we strive to provide timely and comprehensive care under one roof in a family-friendly manner.